The sacroiliac joint is the joint between the sacrum and the ilium, and it can be a source of low back pain. In this video, we'll talk about the presentation, some common myths, and a rehab approach for SI joint pain. For presentation, SI joint pain is typically worse with transitioning from a seated to a standing position, running, or some sort of rotational movement like throwing a ball or swinging a club. It can either be a singular event like a sudden twist or a quick movement that leads to the pain, or it can be a repetitive overload mechanism that leads to the SI joint pain. The diagnosis of SI joint pain can be made through a thorough exam, and imaging like an X-ray or an MRI typically aren't needed unless we're trying to rule out a non-mechanical reason why there's SI joint pain. When it comes to SI joint pain, there's a lot of common myths that aren't supported by research. The first would be that the pain is caused by some sort of movement issue in the SI joint. This could be either some torsion of the pelvis, rotation, or some sort of other positional issue of the joint. However, the joint itself actually moves very little. For rotation, it's somewhere between 1 to 2 degrees, and then for translation, it's somewhere between 2 to 4 millimeters. So both of those motions are far too small to be able to detect in clinical practice. The second myth is that the SI joint is unstable. As the joint that connects the lower extremity to the upper extremity, it's actually a very stable joint, not only from the size and the shape of the joint, but also from the ligaments, because we have ligaments on the back side, on the front side, as well as in between, which help to provide stability to the joint. And that's not even including the muscles that cross over the joint that also provide additional stability. Of course, trauma, pregnancy, or some sort of underlying connective tissue disorder can lead to increased mobility in the SI joint. Those would typically warrant a slightly different approach to the treatment of SI joint pain. However, in this video, we're talking about mechanical SI joint pain, which would be majority of the cases. For rehab exercises, there's two factors that we want to consider. The first is that we want to build up the strength of the muscles around the SI joint. This helps to improve the tolerance of the SI joint to load. The second part is that we want to gradually expose the SI joint to painful positions. This will help to build up the capacity of the SI joint to tolerate those movements. So really, our rehab exercises need to blend the two of strength plus movement. The first exercise is a quadruped rock, and the goal of this is to slowly move the SI joint through a full range of motion. Initially, it might not be tolerated to go through the full range, so we can stop wherever we start to feel pain, and then just go as far as we can. And then as we build up some tolerance, we can go through that full range of motion. To increase the load, we can flip the exercise over and perform a glute bridge, which will use gravity to increase the challenge of the exercise. Make sure that we're squeezing our glutes to lift the hips up, trying to get full extension at the top, and then slowly back down. Sometimes there's pain in the SI joint with full hip extension, so we can use an exercise band around the knees, pushing our knees out against the band to get a little bit more muscle recruitment as we perform the glute bridge. The next progression is to do a tall kneeling hip hinge, initially performing this body weight slowly, so we're just working on going through the hips, lifting up so that we're in a nice straight line here, and then slowly back down. The nice thing about this exercise is there's a variety of different ways that we can actually load it to increase the challenge. For example, hold a weight as we perform the hip hinge. We can also load just on one side, which will increase the challenge and the stability demands as we perform the exercise. Finally, we can also include an exercise band, which will add a little bit of rotation. So the band is trying to pull me this way, but I'm trying to resist that motion as I perform the hip hinge. And then finally progressing to a squat, and we can use the same framework that we used for the previous exercise, starting off with a body weight squat and then moving to a weighted squat. And a different variation that we can do is a split squat. So we'll have our feet separated and then slowly lower ourselves down towards the ground. Again, starting off with body weight, then adding some sort of weight, and then we can also add the rotation with the exercise band as well.